My name is Dr. Rick Sigil.
And action. Hey, Jay, had a... This is curcumin.
Stress and coping.
And action. Hey everyone, it's Dr. Rick, and today's Minute Clinic is to extrapolate on what to use with arthritis, specifically in this case, cat's claw. This is the first time you're finding me though. Don't forget to hit the subscribe button down below and share this if you have somebody that's on the fence with regards to using chronic anti-inflammatories like ibuprofen, Motrin, Aleve, Advil, Naprosyn. Those are all anti-inflammatories. And there are prescription anti-inflammatories like meloxicam, nambumetone, etodolac. They're all good, even indomethacin, which is a really nasty one, but it does work. However, if you're on the fence on using that stuff, cat's claw, turmeric, CBD, excellent choices. So arthritis, it doesn't mean just because you have arthritis, obviously I mean arthritis, it does not mean that you can't move, and it does not mean that you're going to be a prisoner to anti-arthritic medicines for the rest of your life or seeing a rheumatologist, but it does mean that you have wear and tear. Now, if that wear and tear happens to correlate with the pain that you're suffering from, maybe you do need a surgeon, but just because there's arthritis doesn't mean that you have to have surgery. Just like my back, I have an MRI somewhere. I did a video on bulging discs. Just because you have a bulging disc doesn't have to have, you don't have to have surgery, but you do have to fix the mechanics around it. So this is a knee. This is a right knee. You have to fix the muscles on top, muscles on the bottom, the flexibility. Then maybe you go on the inside and fix structures. But it's important to understand that arthritis is a normal process. Sometimes some people have the process accelerated, runners, but if you are on the fence, you're enjoying what you're doing, but it's a little bit painful, especially with movement. Sometimes if you've already maximized on your curcumin, the turmeric, which is a great anti-inflammatory generally for gut or all joints, it'd be important to target just those specific areas with cat's claw. So unaghe de gatto, cat's claw is an herb that's found in the Amazon, and I have a couple of things to back it up. All these are small studies, but even small studies with like an N of 50 are still worthy to be looked at, especially if they have no side effects. So that's what I put together here. So this is just data that shows you about, or tells you about cat's claw. Also nice information that tells you about the occurrence of arthritis. Usually by the time you hit 40 in the United States, about 90% of x-rays or people will have arthritic change. Again, it does not mean that you will have pain. It does not mean that you will have to have surgery or an injection, but pretty good. It also explains how cat's claw theoretically, not in theory, but in studies affects TNF alpha and NF kappa B. Those are two little steps in the cell that are responsible for turning on inflammation. This is also a small study that showed that use of cat's claw did decrease subjective pain. Now, this is definitely subjective, so there's a lot of user bias that can be involved with that. Still supportive, not causally, but correlating with possible outcomes, good outcomes. This is a study that showed essentially no side effects with dosing. Again, small studies, but worthy of considering, especially if you're kind of putting together options aside from using an ice pack or putting compression on. This one is a study that it also will give you protection. That's really cool because when they preloaded patients that were about to use a bigger medicine, when they preloaded with cat's claw, it decreased the side effects from the anti-inflammatory. Specifically, I think it's indocin. Indomethacin is a great one that's used for gout a lot. It just is so gastrotoxic, meaning it puts holes in your stomach. Advil will do the same thing, honestly. Usually if you have to use anti-inflammatory, I think that's fine. If you have to use a steroid, it can only be for a couple days, but anti-inflammatory, I'd use meloxicam, nambumetone, or etodolac. Those are kind of like safe COX-2 inhibitors. But again, they can still technically cause problems with kidneys too, liver, but if you wanted to go natural and you're not that bad, I would try these two, like I said. So the dosing of cat's claw is usually twice a day dosing. This is the only one I was able to find a fruitful yield, and one study I came across said you have to be careful with tetracyclic oxynol alkaloids. This has penta, so I think we're okay. I have to do more research as far as how Now Foods presents, but when I went to Fruitful Yield, they only had one brand. You can probably find other ones online. So other benefits, and I would try this. If you're going to do turmeric, then do turmeric, but do turmeric for about a month, twice a day with what I recommend, because it was approved by Consumer Labs. And then if you don't notice any great results, without changing icing or activities or relative rest, if you're a runner and you want to take it easy, then you add the cat's claw twice a day for about another month, and you see if that formula works. If that doesn't work, then you might want to add CBD. I don't have a copy, or I don't have a bottle of CBD, but CBD dominant medical cannabis, I think twice to 3 times a day would be reasonable too. That is a nice potpourri or a nice recipe for natural anti-inflammatories, in addition to avoiding bad foods. So there are some bad foods that I would highly suggest you look into. I've always said that I don't like, not that I don't like Dr. Gundry, but he's growing on you. He's growing on me. But I think his list is brilliant of foods to avoid, because I have a lot of vegans, vegetarians, plant-based patients that follow me. And I think their plant-based is definitely something to consider. But sometimes plants will also cause problems. So there's a lot that has to be found in the foods you eat, especially if you're arthritic. So I'd highly suggest looking into plant-based food, or avoiding certain plants. If you are insulin resistant, which most of my patients are, fix that too, because it might fix uric acid, triglycerides, and a couple other things. There is Joe Mercola came up with a book of Fat for Fuel. Also a nice investigation, or a nice story about getting into ketosis with high fat, low carbohydrate, which I think helps. I might be deviating too much from a good anti-inflammatory diet, but something to consider, especially if you have diabetes or insulin resistance. This also showed that cat's claw helps with decreasing neurofibrillary tangles. There are proteins in the brain of Alzheimer's patients, tau, and so without getting into too much detail, just realize if you can decrease inflammation in the brain, you might actually effectively change Alzheimer's disease. And again, Alzheimer's disease, which is why I brought up this, because Alzheimer's disease is technically called, no, not technically, but sometimes called diabetes type 3. So there's a lot of inflammation that occurs from the foods we eat. So I'm hearkening back to nutrition. Certainly if you're an athlete and you've been watching your diet, just putting a lot of miles on or a lot of weight, you can screw up a joint or two. And if that's the case, as you get older, decrease the activity a little bit, but get on supplements. But most importantly, change the food, because a lot of the food that we can tolerate when we're younger could be a problem. It's not that you can eat that food and not have a problem, but sometimes multiple foods all together at the same time will have an additive effect, whether it's all together at the same time or it's over the course of several 10 years. But sometimes if you have the arthritis and you're bound for surgery, I would do as much as I can to avoid the surgery. So if there's inflammation that can be reversed in the brain, then you know there's inflammation that can be reversed in your joints, even if you're a rheumatoid arthritis sufferer. The final thing I'll bring up is that sometimes there's this study found that when you used cat's claw in addition to adjuvant therapies for chemotherapy for cancer, it did help. So it wasn't the only thing that we used, but it was used as an addendum to the treatment plan, the protocol. So again, that's got to be the best support or best data that says it's a great anti-inflammatory, because breast cancer is inflammation. If you can accelerate the improvement with something as easy as this, I mean, if there's no side effects, why not? This is only like $16. So I would highly consider, I would give a cat's claw a thumbs up. I'd say that it is important to consider changing lifestyle, losing weight, working on activity, flexibility, and food, in addition to everything else that we have to be working on. But you'd be surprised, because the stuff that you're working on to reverse inflammation will be the same stuff you work on to live to 103. So hopefully this gives you a couple of ideas on what to do, what's normal, what's not normal, and when to pull the trigger. So for those of you with arthritis, I'll put a couple links on CBD and my turmeric. Otherwise, don't forget to subscribe and pass this on to other people, and I'll see you at the next video.